Hi, I'm Joan Dauhajre, and I'm the Chief Patient Experience Officer for University Hospital. And I'll explain what that role means in a minute, but I started to be a Patient Experience Officer at the age of 13. I would work in my father was a physician, an OBGYN, and I was very entrepreneurial. I wanted a job at 13. So he was smart and let me work in his office. But that's where I learned what it meant to put the patient and their culture at the center of everything you do. If you want to really have your patient be empowered to heal and to follow your protocol, giving patients a prescription is not enough. So at first I didn't get it, but then I started to get it as I saw the outcomes. I would see that my father would sit there and look at photo albums for an hour with a patient and hear their stories and actually walk them across the street to the local drugstore because there was not a CVS at that time, and actually tell the patients, you know what, they're holding samples for me, and half the time it's that in his assessment, he knew that the patient wouldn't be able to get the prescription that they needed in order to complete their healing. So his taking the cultural aspects of their care and incorporating them into the healing aspects is what really brought me to where I am today, in keeping the patient at the center of everything we do. So that's a Chief Experience Officer. Essentially, I love that job because I could change the way healthcare is provided, not only for one patient, because by profession I have a master's in psychology and a master's in social work, but for all patients, because we're changing policies, we're changing how we complete assessments, we're changing how we put the patient at the center of what we do at University Hospital. And that's very powerful for me to be a part of that. And I'm a member of La Familia, so it's not just myself alone. I always say I'm an orchestra leader, but I can't do my job without the orchestra playing the same music. And I'm very lucky to have that at University Hospital. So briefly, how we do that is looking at patients' care from the moment they see a billboard on the street all the way through their discharge. So we need to keep in mind when we treat our patients how we assess them during admissions. Our information desk, understanding that the extended family is important and allowing the extended family to visit rather than having all the regulations that exist in healthcare. So we've taken down a lot of the barriers to people feeling that they're a part of their treatment process. We have also strongly focused on how we deliver care. With physicians, medical students, Dr. Soto Green mentioned working with the college students and the first-year medical school class, and having them understand that transitions in care means putting the patient at the center. Medicine used to be practice where you told your patients what they needed to do. Now you learn about your patient and you ask them which of the options they'd like to choose. And I think that's made such a difference in care. So throughout care, the literature we give out, understanding healthcare literacy. We've had cases where patients have had to return and be readmitted, and they were asked, so why didn't you follow what you were told? Well, it was in writing, but they didn't have literacy. The patient couldn't read. So more and more, not only for the Hispanic population, but for all our patients, we're looking at our patients holistically and making sure that we provide literature they understand. We communicate in a language they understand. And I work with many Latino staff and thank them for the work they do, because speaking Spanish is not enough. We have to understand a person's diet, their culture, their need for extended family, and how they view healing. And I hope I'm playing a role in that at University Hospital. And I'm very proud to be part of La Familia, so thank you.